Hi, welcome back. I thought I would do another quick video today because today is the 1st of July and it's been a big day here in GP land. We've had some significant changes to a variety of MBS items. There's been some pandemonium as usual whenever there's software updates involved, and a whole lot of confusion and questions. I feel like all I've done all day is answer questions, but that's fine. That's okay because we're all here to help each other. So I thought I would do a really quick video now just to kind of briefly provide an overview of the things that have changed today and how some of those things have actually panned out in reality, and just to make sure that you have some information about what's happening, and how it's affecting your workflow and things like that. So as usual, if you have any questions, please pop them in the comment section below, and I'm happy to address those either in the comment section or in a future video. If you're liking the content that I'm starting to put out, please subscribe so that you can keep up to date when I do release new ones. And yeah, by all means, always give me some feedback because I do love to hear your thoughts on what I'm doing for you guys. All right, so I guess the big one is the chronic condition management plans that have all gone live today. So we've gotten new templates in our clinical software. We have got new MBS items that have been added to the clinical software. We have got appointment types and reason for visits, and all of that kind of stuff has now been updated to reflect the changes. We've transitioned from chronic disease management plans and team care arrangements, and now we just have the chronic condition management plan, or the GP chronic condition management plan framework, which has significantly changed. I'm not going to go into all of those details in this video because I have done a pretty big video on this one already about the changes. When the MBS descriptors were released overnight, there were no surprises in terms of what we got told in the fact sheets that were released previously. There was no sneaky little surprises added into any of that information. So basically what the descriptors have done is really outline everything to do with the changes, including all the transition arrangements over the next 2 years. And I think they also included a fair bit of like FAQs. So maybe they've combined some of the information from Ask MBS and put it into the descriptors so that it's a much easier and centralized area for people to have all of the information. So if you went on and had a look at it online, you would just, and you could, by the time you went through all of the explanatory notes as well, it was quite an extensive, it was like scrolling, and I like to kind of print things off so that I can like highlight stuff and whatever. So I have got quite a sizable little document here that I read through over my coffee this morning. So look, I didn't find anything really extraordinary in terms of, like it was what we already knew was coming. I actually quite liked that it was very explanatory. Everything is here in this whole descriptions. So I really liked that. Yes, it's a bit lengthy and it's wordy, but you know exactly where to go to get the answers. And I think it was very clear. So moving forward, all new care plans from here on in are now transitioning over into this chronic condition management plan. If you have a patient who is due to have a renewal of their plan or a review of their previous plan, anytime from here on inwards, you now have to use those new item numbers. The 965 is going to be the first thing you put through. So regardless of whether they're due for a review of their previous 721s or 723s, or whether they were due for a whole new plan, you will always now start with this 965. And then after that, you can just continue to review. You can do a new plan every 12 months. Or you just can continue to use the review item numbers. It doesn't really matter. The monetary value is the same. that there's no change in that. You can just keep reviewing the original plan unless it needs updating, of course, and then you can just do a new one. So yes, that's the really important thing, because I think that's been one of the big questions I've seen a lot today is what do we bill next, and when we next do a care plan for somebody. It'll be 965, because you can't bill the 967 review item number unless there's been a previous 965. So I hope that that's clear. So yeah, if they're due for a review, there is no 723 anymore. You cannot bill that. So just start off with a 965. So the allied health referrals, there is, I know my practice uses best practice. So I know with our software, there was a allied health referral template that was included in the update. Incidentally, you can find these new documents up in your word processor template section. So if you go in there, and they're called GP CCMP or GP CCMP allied health referral form. But yeah, just look for the GP CCMP and you'll find them. There was a couple of documents there. So yes, with the referrals, they did have a sample template there that we can use. It was very, very basic. So yes, you can use that as a basic one, and then add to it if you like, or customize that one to suit your practice and the way that you and your doctors like to do things. So technically, yes, you don't need to stipulate how many sessions that the patient is going to go and see that allied health provider. They did give a rationale for that in the descriptor, and essentially they're saying that it's just to allow the patient the freedom to extend that treatment beyond what those specified number is on a referral. So you've sent them for 3 visits to the physiotherapist. The patient can continue to see the physiotherapist beyond those 3 sessions. It's just not going to be covered as part of the MBS supported visits. So it's going to be through their out-of-pocket expense or private health insurance or whatever. But it's just not going to be through the allied health referral pathway as a part of their chronic condition management plan. So I guess I understand that, but I just think it's also wise to just go ahead and put a simple statement in that referral to say, yes, Mrs. Brown wishes to access 3 care plan supported visits to the physiotherapist to assist with her osteoarthritis, and she is aware that she can continue treatment beyond those 3 sessions if required or deemed necessary. I think just a simple statement like that just makes it really clear for everybody. It's clear for the patient, it's clear for the allied health provider, and it's clear for the medical team here at your practice what has happened and where they're going and stuff like that. There was some information in there as well to say that there's no real restrictions on the referral. So if you just do a referral to a physiotherapist, essentially the patient can take that referral to any physiotherapist, even though you may have designated XYZ Physiotherapy Centre. They don't have to take it to XYZ Physiotherapy Centre. They can take it to ABC Physiotherapy down the road, and provided that ABC Physiotherapy wants to accept those referrals, and they can just do it. I think that makes it, again, a little bit challenging, because then you need to be able to follow up to make sure that they are sending through their reports to you as part of their conditions of accepting that referral. So I guess it's, you're going to be sending this document off on your letterheads and all of that. So I guess there's an argument to say that they'll know where to go. I just think that if they're patients just chopping and changing it and taking it all over town, then you're just not going to be able to keep track of it very well. So maybe just making sure that you're explaining that to the patients, that, you know, if you decide that you want to go somewhere else, then let me know and I can simply just change the referral. So that was the care plan or the chronic condition management stuff. Today, 1st of July, we also had the launching of the new menopause, perimenopause health assessment item number, which is 695 for GPs. So I'm not going to go into that in too much detail. I did do a previous video outlining how a nurse can be involved with that particular health assessment. There wasn't a whole lot of information that come out because I don't know whether it was just overshadowed by all of this chronic condition management stuff. But yes, there is a health assessment available for any woman who is experiencing perimenopause, menopause, or ovarian insufficiency. And there's no age limit on who is eligible for that. And there's a little bit of criteria to meet in terms of the submitting a billing, an MBS billing for it. And that's all well and truly laid out in the item descriptor, which is available on MBS now. And as I said in that previous video, I think the nurses can absolutely be involved in this. So there's no templates available, but I do recommend looking up the guideline management. And I know that Monash University and I think RSCGP have guidelines on how to manage someone through menopause and perimenopause, etc. So I think developing your own autofill that guides your assessment of this woman, and then that helps them to meet the criteria for the billing. And then you can separate that up into a section that the nurse can complete and then the section that the doctor completes. So there's no template for it as such that came out with the software update or anything like that today. The item number is definitely there to claim, but yeah, I think I would be very surprised if there is a template that comes out for it. So I think because it's just going to be such a varied, individualized plan that I don't know. Maybe I could be surprised, but if there is, it might be a little way off. Finally, the other thing that I wanted to mention that went live today was the National Lung Cancer Screening Program. This is through the NCSR, the National Cancer Screening Register. Yes, I did go and have a quick look on this register today. There is some forms there that you can access. Then there is also plenty of resources available through the Department of Aged Care, Health and Aged Care and Disability. That's all online. You can print those off and laminate them. There's a training module available for GPs to complete through the Lung Foundation Australia. So if you go look that up, it takes about 3 hours, I think, for them, and that just takes them through that entire workflow of what it is, what the program is, who's going to be eligible, how you're going to go through and do it, how you do the results and all that sort of stuff. So it's a pretty extensive screening program, I believe. There are new item numbers that's been attached to it, but just that's for the screening part. It's not for the GP to claim. And then there's some cool little eligibility tools. You can print them off and then the patients can use the QR code to scan to see whether they're eligible. They can do that in the waiting room. So I think this is really exciting that we've got this now as part of our screening programs. So it'll be interesting to see how that all kicks off moving forward. But yes, that has gone live today. I think you do need to register through the NCSR to be able to do it so that it pops up. But you can also go off and do it independently through the actual NCSR portal anyway. So off if you don't have it in your software. Apart from that, I think there was also just a few other MBS item number changes with regards to, doctors referring for B12 blood tests and urine tests and things like that. So there's just been some changes to the criteria for that. So minimum periods of time that the doctors can refer to go and have those testings done for free. So there was just a lot of stuff going on with all these MBS item numbers today. So everybody's just like walking around crazy. And I'm here on the east coast of Australia in New South Wales, and the weather is a little bit, how you going today? Everybody's it's been wild in more ways than one. So I think I'll just leave it there, because I have done some other videos already on some of this stuff, and I'm probably going to do some more in the future. But I just wanted to just touch base and say, yes, there's all of this stuff that has come out today. It's all a little bit confusing, and it's always the way, but we'll get there. The other thing that I wanted to mention as well, just with the chronic condition management stuff, if you're using best practice, because I like to use the care plan stuff that's down in that sidebar where the enhanced primary care column is, where you've got your health assessments and diabetic cycle of care and then care plans, and that was all. And I looked in that today and it hadn't changed, and I'm like, no, I don't like the other template system that's in through the word processor. I'm just so used to doing it the other way. And I saw, oh, it hasn't changed. They haven't changed anything. But then I think I was I had the test patient open or something, and I was trying to show one of the other doctors something or other, and I realized that even though you can go in and do the plan through the same way, it actually does come out as the chronic condition plan. So even though it doesn't have it written up that way on the tabs at the sidebar, when you do go into the template that in that section, it does actually show up that it is a chronic condition management plan. So I was very happy about that, because I was like, no, I have my system, and I have all my templates all sorted so that I've got my prompts to do everything. So I thought, oh, please don't tell me I have to do this all over again to do it the other way. So I was mucho relieved that it was not going to have to be that way. So yes, if you are someone who does like to do your care plans down through that particular part of the program, then you can still do it, and it will come out as the chronic condition management, and away you go. And obviously you won't have to do the team care arrangement section. Okay, I think that's it. All done. Thank you so much for joining me again. I do appreciate it. I know that I'm a little bit new to doing all this stuff here, so it's probably a little bit boring to sit and just watch me talk, but I'm learning, I'm getting things better, so I'm hoping that we can just continue to improve this channel together. So thanks so much, guys. Pop in the questions if you have any. See you next time.